Welcome, everybody. We're going to give everyone a minute or two to join before we get started. This is Christina Mills from the California Foundation for Independent Living Centers. Looks like we still have some folks entering the room, so we're going to give everybody about a minute to connect so nobody misses our introductions. Thank you for joining today. All right, doing a countdown to the start time. Looks like we have a couple of folks still joining. Thank you for coming to today's Hubs and Spokes Town Hall event. It looks like we are at a stop in terms of attendees rushing in. So I'm going to go ahead and turn it over to our welcoming speaker, Carrie England.
This is Megan real quick. We need to do access. I'm sorry. So this is Megan at CFILC. Welcome to our webinar. We do have captions available today. You can access them on Zoom by going down to your Zoom toolbar and looking for the CC closed caption button. When you find that, select the option that says show subtitle to see the captions in Zoom. We also have captions running on stream text if you'd like to follow along on a separate device or screen. And I just shared that link in the chat. If you do need any support throughout this event, please go ahead and email me at Megan, that's MEGAN, at CFILC.org, and I will help out as I can. We do have chat for this event closed. We will be sending resources to you in the chat though. If you have any questions for us, we're asking that you send them to us using the Q&A on Zoom. You'll want to go down to your Zoom toolbar and look for the Q&A button. And we have it set so that folks can actually upvote on questions that you see. So if you see a question that was asked that you want to hear answered during today's webinar, please go ahead and upvote that question. And then we also will make time for folks who would prefer to raise their hand if the Q&A is not accessible to you. So you can use the raise hand feature. If you're on the phone, you would dial *9. If you're using a Windows computer, you would do Alt+Y. And if you're on a Mac, it would be Option+Y to raise your hand. And finally, we will have some polls throughout the event. When we launch a poll, we will leave it up for about a minute with silence so that folks using screen readers have time to access that poll. And with that, I'm going to go ahead and pass it to Carrie to get us started. Thank you.
Great. Thank you, everybody, and welcome. Thanks so much for joining us this afternoon. Happy Wednesday. My name is Carrie England. I'm the Executive Director of the State Independent Living Council, and I have the distinct pleasure of introducing you this webinar to all of you and welcoming you all to our town hall meeting. The California Foundation for Independent Living Centers, the State Independent Living Council, and the State Council on Developmental Disabilities have collaborated to bring you today's event, which is a town hall conversation on the California Department on Aging's Hub and Spokes model. As we know, the intersections between disability and aging continue to remind us that we have to create a system that brings us together in the aging and disability community. We can't continue and we shouldn't continue to work in silos because all of these important issues impact all of us. So today we're really hoping to provide an overview of what Hub and Spokes is, to provide some real life community examples and give you some resources. And really we want to learn from you. We want to learn what should a Hub and Spokes no wrong door system look like in California? How do we build better and more inclusive programs? What do you want to see in this? And so with that, I'm going to introduce my friend and colleague, Connie Nakano, who's from the California Department on Aging, to review the agenda and go over some important items. Connie?
Thanks, Carrie. Good afternoon, everyone, and welcome, and thank you for attending. So we've got a packed agenda today. Today's agenda, we'll be going over the opportunity for California to build back better. We'll review the proposed vision, the hubs and spokes for aging and disability in every community. We'll hear a few local perspectives about the opportunities, challenges, and recommendations. And last but not least, we'd like to engage in a conversation with everybody that's attending as well. So just to go over a few of the details, more information can be found about our Hubs and Spokes proposal on the CDA webpage. If you go on the homepage under highlights, you'll find a direct link to the Hubs and Spokes initiative webpage. There you'll find resources, including the AAA maps, organization, federal, state, and local funding, local hub examples, and also research as well. So lots of information on there. And just to give you just a quick brief overview of the stakeholder engagement opportunities that we've had over the last few months. We've had our initial kickoff, our virtual town halls. We have an online feedback survey that's live right now. We have leadership webinars, key stakeholder group meetings like today, as well as we welcome any written recommendations sent to us via email or mail as well. And we'll have a results briefing on December 15th. Next steps for this is we encourage all engagement and feedback through October 15th, whether it's attending a town hall, one of the webinars, or sending us an email. We encourage all that feedback to come to us by October 15th. California Department of Aging and also the California Commission on Aging will be hosting a results and recommendations briefing in December, which will be tentatively, we're looking at December 15th, in partnership with Cal State Sacramento. So what will happen at this briefing is we're going to be collating everything that we've heard during the town halls, the webinars, feedback, and go over it as a group and see what themes have come out, what possible recommendations may come out of that. What all this means is that it could, include, recommendations on state bills, on budget, any additional CDA programming, local actions, and more stuff to develop and advance our recommendations as well. So now I'd like to toss it over to Carol Swartzlander, Executive Director of California Commission on Aging.
Good afternoon, everyone. I don't know if I'm on screen yet.
This is Megan. We can see you, Carol.
Okay, great. Thank you. Sorry. Good afternoon, everyone. Yes, I'm Carol Swartzlander, Executive Director of the California Commission on Aging. The Commission is an independent state body established in state law to serve as the principal advocate for older Californians. And similar to the State Independent Living Council, members are appointed by the governor, but also both houses of the legislature, and have to represent the ethnic, cultural, and geographic diversity of the state. So over the last 2 months or so, the Commission's been very pleased to partner with the California Department of Aging to convene these town halls to solicit feedback from all stakeholders on how structure at the local level might look, what a hubs and spokes might look like. And I echo what Carrie said, that we are here to listen to you, to get your input and to hear how you think this might work. Next slide. So we all know aging is changing. By 2030, the 60 and older population will surpass the 18 and younger for the very first time. We know that Americans prefer to live at home and in their communities. There was a Scan Foundation and AARP nationwide polls that actually confirm this, but I know everyone on this call understands that that is real and we all prefer that. And then finally, older adults are approaching their retirement years differently today. And as exemplified by the members of the California Commission on Aging, over half are over age 60 plus. They remain, many are still working full time, and many are volunteering in their communities and serving as caregivers. And then I would also add that, as Christina likes to point out often, there are many individuals with disabilities who are also aging, actively working and contributing to their communities. Next slide. So today we really do have an historic opportunity to build back better. The convergence of 3 factors is helping with this. First, we had COVID-19. It really exposed the strengths and weaknesses in our systems, but it also taught us how to pivot and learn from innovations. Secondly, we had the master plan for aging. I mean, the fact that it came right at this time is actually amazing. So I think that's probably, in my lifetime, I've never seen anything like this, so I'm very excited. And then third, we have historic investments in both the federal and state levels into home and community-based living, navigation, transition, workforce, and infrastructure. And some of you may know me from previous work with the state. I've been with the state for 20 years, and I've had a really Wonderful opportunity to work on several innovative grants, projects, and programs. I was actually one of the original, I actually served on the team that drafted the Money Follows the Person transformation grant that we received. It's now called California Community Choices. It's now made permanent in state statute, has general fund, and that is the state's nursing facility to home transition program. So I'm very excited about that. And then working at agency from 2007 to 2014, I worked on the Systems Transformation Grant and the ADRC initiative when we were cobbling together just federal grant after federal grant, trying to keep the ADRC initiative moving along. So to have this historic investment in home and community-based services in our infrastructure is really exciting to me. And I'm really looking forward to the exciting times ahead. There's a lot of work to be done, but I'm very hopeful for the future. Thank you.
Thank you, Carol. This is Christina Mills from the California Foundation for Independent Living Centers, and I am very excited to be able to introduce our next speaker and soon to be moving on to a new role, Kim McCoy-Wade, the current director of the California Department of Aging. For those of you who have not seen yet, there was a press release that came out yesterday, and Kim will be moving on to the governor's office and will be a very key ally and point person in ensuring both the master plan for aging meets the goals that we set out to accomplish, but also in moving the disability and aging communities in a very positive place over the future. So with that, thank you, Kim. Very excited to have you here today, and congratulations on your new position.
Thank you, Christina and CFILC. It's great to be with you all. I'm going to keep talking, assuming you can hear me, and wait a second until you can see me.
We can both. Thank you.
Okay, great. I get to see the word that says Christina Mills on my screen, so that works out great. I'm glad to be with you all. And what I want to do is bounce right off of Carol's comments about the moment we're in and briefly talk a little bit more about the Hubs and Spokes initiative, but really want to get out of the way to hear the whole panel of speakers and then have the conversation. So next slide. Going back, this really did come out of the Master Plan for Aging, which identified among 23 strategies, but when it was released in January, one of the 23 strategies is leadership at all levels for aging. So when you look at our initiatives, you'll see one that was about revisiting California's area agencies on aging local leadership structures to meet the growing and changing needs in advanced equity. You can also build out No Wrong Door statewide for public information assistance is another initiative, which of course ILCs know well. There was another one to create a governor's office, which, as Christina said, was proposed in the January budget, funded in the July budget. And yesterday I was offered and accepted that position. So that's very exciting. But again, these leadership changes and revisiting are happening all across the aging space. If you haven't heard, Department of Healthcare Services created an office of Medicare Innovation and Integration and appointed Anastasia Dodson to head that. Department of Social Service just reorganized to create a new division for disability, aging, and housing integration, which will be headed by Claire Ramsey as the Chief Deputy Director from Justice and Aging, also starting Monday. And as I think many of you know, in LA County and LA City, at the direction of their Board of Supervisors, are looking at creating a unified standalone county adult department where the AAA would be housed. So these questions, these conversations about are we ready for the opportunity, and yes, the challenges of the changing nature of aging are really bubbling up everywhere. Next slide. And that really came out of a conversation that those of you, I don't have to tell you about in ILC, but we heard this throughout the 18-month stakeholder process. People are having too much trouble finding what they need when they need it in a way that's meaningful to them. So the picture on the left is lots of wonderful services, but lots of arrows. So people are going here, then there, then here, then there. And on the right is a person at the center surrounded by the comprehensive coordinated services that support home and community living. This is a graphic that we have borrowed from ADRC that speaks as well to aging services generally. Person-centered, comprehensive coordinated services is what is really probably the number one goal that was recommended in the master plan, recommended in the Alzheimer's Task Force, and what our department CDA is attempting to implement. Next slide. So to move forward on this initiative, we launched this 6-month hubs and spokes listening and engagement process, as Connie just outlined. I kicked it off in July with a forum for everyone, having a series of meetings and listening sessions, and then we'll come back in December and summarize what we heard and really put our heads together and work through what are the next steps for 2022. So to kind of move us forward, we said, okay, we'll put a proposal out on the table. Can we, as a state, all align around a common foundation and framework for service delivery that would absolutely need to be adapted and adopted? LA is different from Siskiyou. Imperial is different from San Francisco, but that we would all be rowing in the same direction, aligned around a common foundation and framework in order to deliver person-centered, equity-focused, and data-driven services and outcomes to all Californians as we age. Next slide. And this is my last slide. I'm gonna spend a little bit of time on it. Then we'll go on to the next speaker. But here's the proposed foundation and framework that we are test driving right now. I'll start at the bottom. That every community would have a strong partnership between the area agencies on aging, county adult services, and community-based organizations in aging and disability. Where we see movement towards this person-centered, comprehensive, and coordinated service delivery is when you have those 3 core organizations working closely, strategically, collaboratively together. And that's what we'd like to see be the norm, be incentivized, be supported, be recognized in every community. Recognizing that every community will look a little different. We've got, as you all well know, different maps for area agency on aging, county adult services, independent living centers, Meals on Wheels, legal services, family caregiver centers. We've all got a little bit of a different jurisdictional map, but the key is for the people we serve that they experience a strong partnership between those major pillars of support and services. And what do those 3 organizations do together once they've built that foundation? Picture a house being built with these 6, I'm not a home builder, but you know, the big beams coming up, the frame of the house, if you will. And here are 6 that we have outlined for feedback. The first one is very familiar, that no wrong door, or one door as Marin has branded it, a place that everybody knows who to call, what website to check for aging and disability. We're inspired by what's been done in California around First 5 with young children, or Covered California with health insurance. And we see other states uniting services under a common brand, if you will, to market, promote, help you find it no matter where you live in the state. So that's very much a common ADRC concept that we'd like to dig into and brand our services together. Behind that, connection to not just Older Americans Act services, not just county adult and independent services, but the full range of independent living, whether that's transportation, employment, education, caregiving. We want to make sure that people are set up to succeed with that full range of spokes into the community. Third, quality. It's not just about increasing our volume. We want to make sure that we are rooted in person-centered services, starting with where people are, what matters to everyone, have cultural competence, linguistic access, disability access, so that we are truly able to serve the diversity of California. Partnerships, in addition to the spokes that I talked about, 3 partnerships that are increasingly emerging as critical for aging. One is health plans. We need to partner with health plans who are investing in things like in lieu of services in Medicaid or Medicare Advantage, home and community-based services that can be funded so that we can make sure we bridge social and health and also can have some of that healthcare dollars supporting our network as well as appropriate. 2 other partnerships, again, don't need to tell this network, disaster services, preparedness and planning and response, and our tribal nations, our nation's first elders. We have a historic and legal and moral responsibility to be sure we are partnering deeply with those governments as appropriate to serve those elders. Behind that, plank 5 and plank 6. Plank 5 is the technology and data. As many of you know, we are moving at CDA to, with our AAAs, come into a common CRM, customer relationship management. Currently, our AAAs are in 4 different systems, and we've been working with them to move towards one, and then it begins to make sense. That should be the same platform for ADRC. Let's talk to the ILCs and see if it could work, so that we are all using a common platform so that we're measuring the same thing. We can do outcomes together. We can do public databases together. You can work across county, across ILC, across AAA lines and not have to start all over. You could move. You could work with a relative, a family in multiple jurisdictions. So lots of excitement around the technology and data opportunities. And last but not least, fiscal and admin. We could go on and on about this, but in brief, it is reducing the red tape and increasing the funding to meet the need so that we are all spending more time. And to be more specific, in our world, in the CDA AAA direct relationship, as you know, we are in contracts, and you may not know we are in paper checks, and we are moving to at least do electronic fund transfer, and we would like to be moving away from annual contracts to multi-year contracts potentially, and even to allocations, caseload allocations, just a more nimble way of doing financial transactions. So those are kind of the planks that we're looking at as part of what could be this network. It's really informed by some of the hubs that we've seen and heard about in Marin, San Francisco, San Diego, many other places. But it is really just a discussion starter. We want to hear more from people about how this model resonates. And then really it's about what do we need to do to refine the model and then to build it. What would be the work groups, the regulations, the initiatives, the training, the TA, potentially a bill, potentially a budget, federal reauthorization and more to make something like this work. So I'm happy to stop there. I know there's been questions about how is hubs and spokes different from ADRC, and you can see it's deeply connected. From our perspective as CDA, I don't know if this is helpful or not, but one way to think about it from shorthand is it's kind of we're really focused on the A in the ADRC with this initiative. As the Department of Aging, working closely with our AAAs, we want to make sure that A is as strong as possible to be a good part, to be ready to be the A in the ADRC and be advancing the ADRC vision. But I don't know if that's helpful or not. And I'm really eager to have more questions and conversation about it. But really, it's rooted in the fact that absolutely, as Christina and we said in master plan, a state that is for all ages absolutely includes people with disabilities and the full range of disabilities as people are living longer. Of course, aging often comes with acquiring disabilities as well. We've got aging caregivers of people with disabilities. We've got people with disabilities caring for aging spouses and loved ones. So we age and we have disability in the same person, in the same family, in the same community, in the same system. And so the more we can build on those connections, I think we will be person-centered, equity-focused, and achieve the independent living we all seek for ourselves and for everyone in California. With that, let me hand it to Megan Granata, I believe.
Yes, hi, this is Megan Granata, and I am here to introduce my colleagues who are doing important local work at the cross-section of aging and disability in their counties. I'm here with Eli Gilardin, CEO at the Marin Center for Independent Living, and Larry Winger, who is Executive Director of the Dale Macintosh Center in Orange County. So Eli and Larry will be sharing their experiences meeting the needs of older adults and people with disabilities through their local aging and disability resource connections, their ADRCs, and using the no wrong door model. So with that, I'm going to turn it over to Eli.
Megan, thank you so much, and honored to be here to talk about Marin's ADRC and hub and spoke model, or as we like to call it, one door. So just as reference and context, we started our partnership well before we became a designated Aging and Disability Resource Connection. Back in 2014, our AAA leadership and leadership at our center, Marin Center for Independent Living, recognized there was really a greater need to serve the community. Marin is one of the fastest aging communities in the country. About a third of our population will be 60 plus in the next 5 years. And really it was clear that as service providers and as areas on aging, we were increasingly serving an intersection of the community, and the community would benefit from closer working relationships and communication between our two programs. So as many folks on the call know, Marin CIL supports people with all types of disabilities. We're an independent living center established in 1979, one of the earlier centers. We have a longstanding history in our community, and really our services center around housing preservation, person-centered service coordination, and advocacy. And then just as context again, the Area on Aging, or AAA, really in Marin coordinates a variety of critical funding through Older Americans dollars for safety net programs, including food and nutrition, information and assistance line, in-home support services, adult protective services, ombudsman services, and veteran services. Next slide. So over the years, as we became a designated ADRC in 2019, we really expanded what our hub and spoke model looks like. And I would say the first step was really coming together and funding a position, a administrator, a leader between our two organizations to coordinate ADRC service delivery, advocacy, and partnership building. So that one-door administrator has really helped us in terms of navigating designation, staying on top of our data reporting and communication with CDA, with other funders, and also, helped us expand and build relationships within the community. When we received designation in 2019, and then subsequently infrastructure grant funding, Marin CIL became the fiscal agent or fiscal entity. And we really used those dollars to invest in the service coordination and transition service side of one-door ADRC service delivery. And then through those partnerships, we really began to build other relationships, and I'm just going to list a few. The first and foremost is really building a partnership with advocacy coalitions. And in Marin, we have a thriving coalition called the Aging Action Initiative, or soon to be the Marin Aging and Disability Institute, that works at the local, at the state level on pushing policy priorities, whether it's caregiver equity, expanding food and nutrition, addressing housing barriers like eviction, integrating with other housing services like whole person care, but really adding a lens of advocacy and systems change to the ADRC partnership, which, as those of us in the IL world know, independent living has always been about advocacy and nothing about us without us. The other key extended partner that we've really developed over the year, and one of our other administrators has been phenomenal in leading this, is our partnership with the Federally Qualified Health Center and providing care coordination for high-risk individuals who are medically complex, ensuring that they're connected with the services at home, addressing their social determinants of health, working in partnership with the ADRC. And over the years, we've actually developed a contract with our Federally Qualified Health Center, Marin Community Clinics, through this relationship. And again, to Kim's point, building out this model of an extended network of hub and spokes, engaging healthcare providers and recognizing, again, just like there's an intersection between AAAs and independent living centers in terms of who we serve, the intersection of FQHCs and the health system and the high-risk individuals who need support in the hub and spoke model. As we've seen over the last 3 years with climate change, with wildfires, with just COVID and disaster after disaster, coordinating with local Office of Emergency Services, launching CFILC's Disability Disaster Access and Resource Program, or as we call it in Marin, Powered and Prepared, and working in conjunction with emergency service providers and other CBOs to ensure that our community members are safe during power shutoffs, smoke, evacuations due to wildfires is absolutely critical. I'm just going to go through a few other ones in not as much detail, but just recognizing that transition and diversion support and coordinating with your local ombudsman program, especially during COVID, where we see the greatest outbreak of infection has been in congregate living, is absolutely essential. Paratransit, regional centers, and as an example here, over the last year through the ADRC, through the One Door, we contracted with a regional center provider to ensure that our services as an ADRC, as One Door, were available to all in our community who are aging and have disabilities, and that includes the IDD community. And finally, just ensuring that as we extend our partnerships, we're recognizing that the immigrant community, individuals with behavioral health needs, veterans, housing insecure and homeless individuals are also connected through informal or extended partnership with the ADRC model. Next slide. So I know I've probably blown by my time, but just recognizing, there are key challenges, and it's very important, these relationships between, ADRCs and extended partners, between ILCs and AAAs have to be built on trust, on confidentiality, on clear operating agreements and protocols on how staff interact with each other from different organizations. It's really important to have role clarity. When does, for example, Adult Protective Services take on a consumer, a client, and when does the Independent Living Center or another service provider back off? And also during disasters, having very clear understanding of how you operate for evacuations and housing or finding resources for someone in an emergency. It's also really important to invest your time in your staff development, ensuring that they are cross-trained with their partners in other organizations, that there are opportunities for staff to build meaningful relationships with their counterparts, with their peers, who they're referring to and providing warm handoffs. And that as an ADRC, you're listening to the community, and that means leveraging your local ADRC advisory committee, as well as connecting with other One Door ADRC hub and spoke models in the state to share best practices. As it was pointed out earlier, there is no one model. Marin is going to be different from Sonoma, which is going to be different from Solano. But how can we, as a network of hub and spokes, work together, build out this, coordinated system of support to help our community during these challenging times? Next slide. And just as an example of some of the impact of Marin's One Door over the course of COVID, we've delivered an extensive amount of personal protective equipment, over 3,000 units, supported over 250 caregivers, deployed over 250 caregivers to support individuals with activities of daily living, coordinated meals in partnership with our expanded food distribution network, provided emergency financial assistance through gift cards to help individuals, shelter in place safely, bridge the digital divide, distributing Chromebooks, and coordinating with other partners to connect individuals with, electronic timesheets, caregivers, and other digital resources. As we know during COVID, it's critical to have digital access. Obviously distributed batteries and provided disaster training and coordinated transitions in partnership with the Ombudsman program and our Adult Protective Services and In-Home Support Services program, individuals as they transition from hospital to home. And finally, diverted individuals. One example was our partnership with the Federally Qualified Health Center, but diverting over 1,000 individuals from entering skilled nursing and hospital settings. Okay. Next slide. So I think I'll answer questions at the end, but those are just some examples. And now I'll pass it to my friend, Larry Wanger at the Dale Macintosh Center.
7 minutes starting.
Well, good afternoon, everyone. It's great to be with you today and to talk with you a little bit about what's happening in Orange County. Before we go further, I want to recognize Megan Granata, who introduced Eli and I also as our manager of our ADRC program here. And much of our awesome and excellent work that has happened is a result of her efforts. So credit where credit is due. The Dale Macintosh Center is, as I said, the independent living center serving Orange County. And we've been around since 1977, I believe it's 44 years this year. We became a designated ADRC along with the Orange County Office on Aging in 2019. And since that time, we've grown just dramatically and have really established a model of hubs and spokes that we think is serving the community well and doing amazing work in Orange County. Currently, we've grown to a point where 8 organizations across the spectrum of aging and disability are receiving funding and or have staff positions internally directly supported by ADRC funding and providing services in the community. Our advisory committee, which plays a key role in the work that we do as an ADRC, has grown to include 14 organizations, again, across the spectrum of aging and disability, bringing expertise and experience to the work that we do. With that, as an independent living center, we stress and have valued and continue to push consumer representation, both from the aging and disability community, making sure that individuals who have had direct interaction with service providers and organizations in the aging and disability space are on this advisory committee and have a voice. This has really transformed services in many respects in Orange County. Last year, thousands of individuals accessed services, be it information and referral, transition services, person-centered counseling, and the core services of an ADRC and independent living center. With the growth that we've seen since July, we are looking forward to that number just increasing and building a system that truly serves individuals. I think most important to highlight is that we've instituted a number of referral protocols, some of those processes that Eli spoke about. The partners together have partnered to work together to bring about easy system that provides warm handoffs and referrals across organizations. It's not just here's a phone number, good luck. It's literally that referral process in place. And it's just working incredibly well and only growing as the partners continue to utilize this system. And the beauty of that for the customer or for the consumer on the, who's at the center of what we do is that no matter where they go, what organization, if they're part of the ADRC, they are getting services. And that is the entire purpose of a no wrong door system. We are also continuing to build the capacity of our partners to deliver services, to meet the needs of individuals, to understand the services that are available at the respective partners across the system that we've developed. I can't stress enough how key that is, that everyone who's involved understand all of what's available to individuals in the community by the various organizations. So monthly trainings are provided for staff, and that results in the consumer, individual or family who is trying to access the system having an easier time than ever before in obtaining the services they need. We've recognized in our work that very specific needs exist in Orange County. Housing is a very significant issue, as it is everywhere. We were just thrilled this year recognizing that no organization in Orange County currently specifically offers someone in a role that addresses the needs of seniors in particular with housing needs. Certainly services were available, but we have someone who specifically is in place now as part of the ADRC, helping seniors who need assistance finding housing, in addition to others who are helping folks with disabilities identify housing options. We've partnered with some pretty unique organizations that bring very specific skill sets to the hub and spoke model we have here. As an example, we now work with an organization that also addresses behavioral health and mental health needs of folks in the community, and we can refer folks over to those supports as well. We have co-located staff also at a number of organizations that are DMC employees, but for example, we have a staff person at our public authority, IHSS Public Authority. We have staff who are embedded there. We have staff embedded at our Office on Aging, and at our Veteran Service Office, which has translated to increased capacity for services for veterans in Orange County. Being able to access someone on the phone live and fairly immediately who can work with them and address their needs. And consistent with the nothing about us without us and peer support, we have folks in that Veteran Service Office who are former military members. So they understand and can relate to folks who need services. I could go on, but time doesn't allow, but just to say that what we've been able to get in place and the system that exists that is easily accessible for folks in the community is just tremendous. We feel like there'll continue to be opportunities to refine and fine tune and grow the spokes and bring more folks to the table, both in terms of individuals who need services and organizations who can enhance and expand the services that we offer. And with that, I'll just leave it at that, and thank you for the opportunity. We're very excited about the opportunities that have come because of this model and look forward to continuing to deliver. Thank you. And I think we're going to Aaron now.
Thank you, Larry, and thank you, Megan, and thank you, Eli. This is Christina again from CFILC, and for those of you who know me, you know that I am so completely energized and have the burning in the belly and really just excited about today's conversation because it makes it feel as though we've come not quite to full circle, but we've come 75% maybe of the way of the circle. Back in 2003, I was at Access to Independence in San Diego when ADRCs were being started. And at that point, our Center for Independent Living down there was embarking on this journey. And to see where it is now compared to then is really exciting. And one of the things that I really value about the work that we do at CFILC is that our members are incredibly intentional and inclusive. And one of our core values is, of course, making sure that we are as cross-disability focused as we can possibly be, and also making sure that, especially because of the number of people over the age of 60 that centers are now serving in our current environment, that we are also making sure that our friends and family members with intellectual developmental disabilities are very much a part of the conversation. So with that, I was thrilled to be able to invite Aaron Carruthers, a dear friend and partner of ours, to also join the conversation and talk about the opportunities that we have to make sure that we partner closely with our friends from the IDD community. Thank you, Aaron.
Christina, thank you so much for the invitation to be here, and I appreciate your leadership on so many levels, but in particular, making sure that the cross-disability coalitions exist are strong and are thriving. You really are truly a leader in building those coalitions, and thank you for the invitation to be here today. Hello, everyone. I'm Aaron Carruthers. I'm the Executive Director of the State Council on Developmental Disabilities. State Council exists in federal law. We exist in state law, and there's a council like ours in every state and territory. So we're a network of 56 sister councils throughout the country. And Congress created us to exist to create positive, life-altering changes in the lives of people with developmental disabilities and their families. That gives us a broad permission. We advocate, we help people learn in their own skills so they can advocate, so that we can come together and change systems. So that's what we can do. And we can do anything from stem to stern, apples to eggs, whatever phrase you want to use, we can get involved in it, which means we get involved in many issues. And the issues of aging are becoming more pronounced. And that's good news. That's good news in developmental disabilities, because for so often, having a developmental disability, having a family member with developmental disability implied a shorter life. And life quality is improving. People are succeeding. They're living their lives, loving their lives, and that's what this whole civil rights movement is about. But we're also seeing and learning some things about what that means for individuals with developmental disabilities who are living longer. We're starting to learn a lot about what it means to be a person with Down syndrome and what that association is with Alzheimer's. So we appreciate this conversation and being part of this conversation. We also recognize that our role in this, our part. In the hubs and spokes, we are a spoke. Many of you who are hubs, and we're good with that role because we know that means we can be there to support the work that you're doing, but also the people come to us, we can support them in getting to you. Many of you, I'm in our Sacramento office, but we have 12 regional offices throughout the state. The California DD Council is unique from any other council in that we have these regional offices. Most other DD councils are just one headquarters. We've divided up through our long history to be sure to have a local presence, a regional presence, so that we can keep our eyes and ears on the ground. We can keep our fingers through every part of the California soil. And we can work on systems change that are either statewide in Sacramento or locally. And what that means for the work that we can do together is that the regional offices of the State Council are near you. They're close to you. And as people are coming to us with needs that relate to the hubs and spokes efforts, relates to aging issues, we're able to make sure that we're part of that no-door network. So if someone's coming to us, we're not starting over with them. We're just making sure they know where to go to get to you. I think that's really what we're designed to be, because nationally we're all funded by the Administration on Community Living, and we're under the Administration on Aging. And with the ILC's funding that are received from ACL, the DD Council's funding from ACL, Aging's funding, the Protection Advocacy Organization, Disability Rights California, with the University Centers of Excellence in Disabilities, the TBI councils, the SILC, that federal administration is making sure federal dollars are coming to California so that we're all working together to support each other, so that the people we're here to serve, we're privileged enough to serve, really find no wrong doors. So very glad to be a spoke in the hub and spoke model, where the State Council is structured and well laid out to be able to aid and assist you and your efforts and support people who are needing services for that. So I'm very glad to be here as a key partner. Thank you.
Thank you, Aaron. This is Christina again. So we've heard a lot of information, both statewide and locally, about what this Hubs and Spokes initiative could potentially be. And like Kim said, the approach that CDA is taking is just laying a roadmap for what is potentially possible. And now we really want to hear from you guys. And while we go into the comments and questions section of today's agenda, this is what I want to ground you in as we go there. One, I'm really excited to see that we already have some questions coming in the Q&A box. I encourage more of you to use that option if you can. Knowing that many of us here today are or have been service providers, And we know what it's like for a consumer that gets to our agency who has likely had to jump through a million hoops, has finally found us, and is relieved because of the services they're going to get from us. And that might be information referral, that might be transition services, that might be care coordination. It could be a number of things that the ADRCs provide, the AAAs, or the independent living centers provide independently. But what we want to do in this hubs and spokes model is really create a system, the no wrong door system, basically the hubs and spokes model, to be a place where that consumer comes in, that client, that customer, whatever you refer to them as, I come through your door and I need services. What is the hub in that service model? And what are the spokes? Like Aaron just said, the State Council on Developmental Disabilities is happy to serve as a spoke. Does it make sense that the area agencies on aging, the independent living centers, and together the Aging and Disability Resource Connections, regionally and locally, are the hub to what that consumer needs when they enter a door to get services and to get the LTSS they need to live independently? And can that hub refer you out and connect you through warm handoffs and partnerships to the correct spokes, meaning services that you need to live your best life out in whatever area of the state you're in? So with that said, and that grounding mentality and what this hubs and spokes is all about, I'm going to ask my colleague Megan to come on and share our first polling question for participants.
Thank you. This is Megan from CFILC. I'm going to go ahead and launch our first poll here, and I will read out the questions and then have it be silent for about a minute so that folks using screen readers have access time as well. So here we go. Our first poll is up, and panelists, you should be able to answer the question as well. The question is, tell us about yourself. Are you here today as a consumer of disability and or aging services, as a community member, as a staff or board member of an independent living center, as a staff member of a AAA, as a state partner, or none of the above? And we'll go ahead and leave it open for 1 minute now with silence.
All right, hopefully everybody got a chance to answer that question. And Megan, can you go over the answers that have come in?
You got it. I'm going to go ahead and end the poll now, and I'm going to share the results. You should be seeing them on your screen. On this call, 6% of the attendees identify as a consumer of a disability and or aging services. 6% identify as community members. 34% identify as staff or board members of an ILC. 22% identify as a staff member of a AAA, 14% as a state partner, and 17% as none of the above.
Thank you so much, Megan. And we're going to do a couple other polls as we carry on. I'd like to invite Connie back to facilitate some of the comments and questions and answers that have come in so far. And I see we have 11 in the Q&A box so far.
Yeah, thanks, Christina. So now we'll move over to the comments and discussion portion. So we welcome, if you've got questions, we see there's already some questions in the queue. So we'll go through those. If you'd like to ask your question, feel free to raise your hand. So if you go under your name, you can tap on the little raise your hand feature and we'll open your lines so that you can ask your question. So let's go to, let's see, one of the first questions. Is there any particular reason that the ILCs are not explicitly stated as a major piece of the foundation for the initiatives like the AAAs, as opposed to looped in as CBOs in aging and disability?
Sure, this is Kim. I can take a crack at that. Here's what we were thinking, and again, happy for the feedback. So first and foremost, we were really focusing on emphasizing that anything in the aging and disability space is a partnership between government and nonprofits. We wanted to be really clear coming out of the COVID experience and coming out of many of our lived experience that it is best when you harness the power of government with the reach and community expertise and nothing about us without us with the nonprofit expertise. And so we were really trying to situate that AAA County CBO partnership as conceptually very important. A second, more pragmatic reason is that you may know in aging, we have deep relationships with more than one nonprofit network. Independent living centers, certainly, but also 2 in the Older Americans Act. The long-term care ombuds, which Eli mentioned, is a critical network for us, as well as the HICAP, or the State Health Insurance Counseling and Advocacy Program, where we're having our Hubs and Spokes Forum tomorrow, is another critical nonprofit. And then if you look at our Older Americans Act funding, it is going to, off the top of my head, nonprofit meals providers. Meals on Wheels is the one most popularly known, but other meals providers, legal services nonprofit providers, and family caregiver resource centers, among many others. And so there's a little bit of a problem of just once you start naming, there are several who we have a significant historic, statutory, budgetary relationship with. And then last but not at all least, of course, we, CDA in a more formal sense, has the oversight relationship with the AAAs. My partner, Director Joe Xavier, who's I see here as well, of course, is the lead entity with the ILCs. So from where we sit, it's appropriate to frame the AAA, deep partnership with county and CBOs. It's important to acknowledge there's multiple CBOs we work with, and it's also important that we, even as we partner, we're clear about our role. So if that doesn't, again, open to feedback on how to better communicate the AAAs and ILCs, but that was the thinking behind it.
Great, thanks for that answer, Kim. So let's see. Noting the importance to break down silos between aging and disability that has been highlighted, I wonder if CDA has considered partnering with DOR and DDS on initiative, particularly around technology and data.
Absolutely. Great question. So first, I'll say yes and not yet. Yes, with DOR and the ILC network, we absolutely have very much realized that if we are moving together with our AAA network into a common CRM, again, out of 4 different systems into one shared system that the state would also be in, that it would make sense that that system also work for ADRCs and ILCs. So that system has been demoed with DOR and with the ILC ADRC network to look at that and see if that would work for ILC ADRC. We're also doing the same with our meals providers because we do want this system to work in that very operational way. So yes, that has happened, and that's very much part of the both AAA and ADRC conversation. Why I say not yet on the rest is that we were just received funding for ADRC interoperability, which means we do want to be able to have our system play well with others. So that would be systems like County Social Services, Medicaid and CalFresh, County Social Services, IHSS, regional centers systems potentially, health plan systems potentially, emergency services potentially. We want to be able to have that interoperability that's essential to a hub and a spoke being efficient. So yes, very much talking with DOR and the ILC network about can the AAA CRM vision work for ADRC, which is everybody's hope and dream, and then planning for interoperability with that larger spoke ecosystem.
That Kim. How about next? Let's see, I think Eli or Larry maybe can take this one. Are there currently any ILCs that are partnering with multiple AAAs?
This is Eli. I believe that, and I could be wrong about this, but Ventura, well, the ILRC in Santa Barbara that also serves Ventura County is looking to expand to an ADRC, both the existing in Ventura County and also a emerging in Santa Barbara. And I believe something similar might be happening in Grass Valley, Nevada City with Freed. I'm sure there are other examples, but those are the two that come to mind for me.
Yeah, this gives me a perfect example to call out the CDA ADRC leadership who are on the call, Chantel Bush and Wilson Tam. Chantel or Wilson, if you have more up-to-date answers than Eli and I do, please feel free to share them in the Q&A. But yes, we heard about conversations potentially on our town hall and rural remote that San Diego and Imperial were talking about possibilities. And then also in Los Angeles County, which I'm sure someone will correct me, but I believe has 2 AAAs and 7 ILCs. There are talks about how to do that in a person-centered and efficient and effective way. So we can get a more detailed crosswalk from our ADRC team, but that's a partial answer anyway.
So there's a couple questions about the hubs and spokes model and the ADRCs. As I see it, ADRCs provide and are the hub and spoke model. And then can you outline again what the hubs and what the spokes are? So maybe a little more clarification or about what the hubs and spokes is.
So absolutely, there's a huge overlap between ADRC and our hubs and spokes vision. But let me just tell you 2 examples of issues that have come up in this that may show where there's overlap but difference. So one issue that our C4A partners have raised, the California Association for Area Agencies on Aging, is the conversation about core services for all AAAs. Other AAAs are exploring this. New York State has done this. And in fact, we're having a webinar tomorrow from the New York State AAA Association and the National AAA Association about trends like this. So that could be something that comes out of this is the core services for AAA. That would be kind of a, we'll all do this. And then of course, there'll be local additions and local variations, but there'll be a common core, if you will. That's a conversation that is a little bit different than what are the ADRC services, is what is the common AAA services. Another question that's come up for us in California is what is the role of County Board of Supervisors ongoing in partnering with AAAs and overseeing and providing strategic direction with their AAAs. As we all know, county government is more involved with social services and health service than anywhere else in the country. And so trying to figure out that appropriate role, whether or not the AAA is part of the county in the nonprofit sector or a JPA or other model, what is the ongoing role for County Board of Services as local government in continuing aging and disability planning and outcomes? That's a conversation we're actively having with CSAC, the California State Association of Counties. So those are 2 examples of AAA issues that, again, it's that kind of classic Venn diagram, obviously impact ADRC, but are really squarely CDA AAA issues.
Kim, Carol's going to help out with some of the Q&A as well. Carol, you want to read off the next question or comment?
Sorry, I could take myself off mute. Here's an easy one for Christina. Will the slides be emailed to us?
Yes, this is Christina. We will email the slides out after the conversation today to everybody who was registered for the event. Thank you for asking.
And here's a comment. Please consider making the hubs services specific, not organization or population specific. The services are what we all need. Thank you for that comment, Keith. Question, are hubs and spokes germane legislative ideas percolating for 2022?
Well, that's a question I had asked for legislators and our stakeholders in terms of what of these possibilities and proposals that are bubbling would benefit from legislation or need legislation, or what could be done through regulations, program memo, other ways. So I think that's still TBD. That's the kind of thing we think will come up in the December feedback and findings forum, and will be something that legislators and stakeholders will be looking at. You know, I do want to answer this question I'm seeing about CDA has spent considerable time and effort encouraging multi-county AAAs to break up. Let me correct that misimpression. CDA is spending considerable time and energy encouraging people to take a fresh look and look at your aging structures and services and partnerships to see where you've come in your 30, 40 years of service and where you're going the next 30, 40 years. And that fresh look could result in small changes, big changes, no changes. But this is really a fresh look process with no predisposition. So welcome that dialogue, but do want to correct that misinformation.
Thank you, Ken. This is Christina. I will just add to the end of that question, it looks like, will there be similar efforts to change the map of ILCs? That is something that previously has not been an opportunity in the Independent Living Network, but because of some changes that took place through the state plan for independent living last year, the Administration on Community Living has provided some additional input on states having a discussion regarding catchment areas. So redoing the maps is a conversation that states can have now, as well as reallocating some of our federal funds known as 7C dollars.
Here's another question. Where does your funding come from to provide these services? Do you rely on the ADRC funding only, or is there something else?
Is that a question for independent living or for the AAAs? I'm not sure.
Let's, how about like, Eli, how does your model work? I guess from the funding structure for like the ADRC, where does that funding come from?
Sure. So the primary funding mechanism for us is that ADRC infrastructure grant. And that funding, as mentioned, comes through CDA. The Independent Living Center or the AAA have the option of being the fiscal agent, the fiscal entity, and in Marin, it's Marin CIL. But we also, have expanded our capacity as an ADRC and hub and spoke network, leveraging funding from our federally qualified health center through a contract that funds 2 positions in our office. We've secured funding through CFILC as part of Disability Disaster Access and Resources to provide disaster response work. I'd love to work with our partners at SCDD and the Regional Center to explore how we could expand ADRC and WINDOR networks to further support the IDD community. So I think as a base, it's the ADRC infrastructure grant. But there are all sorts of opportunities, both present and future, to expand those resources. Again, with the intention of serving the entire community that's aging with disability, or just a person with a disability who's living their life. So yeah.
Go ahead, Aaron.
Oh, thanks. Yeah, Eli, ideas like that are exactly why we have town halls like these, so we can get out some really interesting ideas out on the table and talk them through and see what they're about. I was grateful to see that the governor and the legislature had a project they funded that was both for DDS and CDA to look at this intersection and the needs in bringing up new programs. But your idea takes it even further, which is how do we then make sure the community supports are there too? So I like it.
This next question kind of piggybacks a little bit on that. How much do we know of the expertise of our partners? This is really core to the quality of our communication and collaboration. We cannot just presume that we know each other when we do the referrals. So like, what recommendations would you guys have in terms of, building these relationships, and how would one proceed with it?
Yeah, I'll jump in if I can. This is Larry with Orange County ADRC and Dale Macintosh Center. And I think I mentioned this is one of the things that we've benefited from. We definitely, as an organization and as an ADRC overall, in partnership with our core partner at the Office on Aging and our advisory committee, are strategic and deliberate in terms of looking at needed services where we need to enhance the services that are available through the network. to better serve the community. And we're pretty strategic about that, and also about talking with other organizations and decision-making process, for example, about extending funding and those types of things, and making sure that we're bringing in folks who have the expertise. That said, there's also a need for trust. We've just really seen the referrals through the network grow, and the confidence among the various partners and the trust that we have. It's just been really great to see. It's not to say everything's perfect. From time to time there are challenges, but we work through those. And I just think that being strategic and deliberate about identifying the needs that your network, that your hub is not addressing or isn't addressing well, and going out and finding that expertise and bringing them in and really working to build that is key.
Here's another question that could be directed to Eli and Larry. Is the Family Caregiver Alliance among the core partners?
In Marin, Family Caregiver Alliance, amongst many other aging and disability service providers, are part of that advocacy network I mentioned in the presentation. And so, through this advocacy network, we're also doing quite a bit of public education and training with service providers, so they're aware of all the resources in the community that support older adults, people with disabilities. There are so many, but also the referral agencies like the Villages, the Alzheimer's Association, MSSP, and other contracted service providers. So they know how to get folks to the ADRC, and vice versa. So our ADRC, our One Door, knows how to get individuals referred to the right organization depending on their needs.
Thank you, Eli. This is Christina. Megan, can you put up our next poll question, please?
This is Megan. I'm happy to. I'm going to launch our second question right now. And again, I will read out the questions and then leave it open with some silence for folks to complete it. Our second question is, do you think the hub and spoke model would benefit individuals with all types of disabilities, including IDD? And the choices are: the hubs and spokes model should be inclusive of all disabilities and individuals over the age of 60. The hubs and spokes model should only include people over 60 that have acquired a disability due to aging, or the hubs and spokes model is not needed. Programs and services are fine the way they are. And the last option is I'm not sure.
Thank you, Megan. We'll give everybody a chance to put in their answer. We know some folks are using assistive technology to do that, so we will give everybody an extra moment to make that happen. Okay, Megan, can you review the answers that came in?
Yes, I'm going to go ahead and end the poll and share the results. It looks like 80% of people on this call feel that the hubs and spokes model should be inclusive of all disabilities and individuals over the age of 60. And 5% of people on the call feel it should be only for folks who are over 60 and acquired a disability due to the aging process. And then 6% of folks on the call believe that the hubs and spokes model is not needed. Programs and services are fine as they are. And finally, 9% of the folks answered they're not sure.
Thank you, Megan. And as we have more questions coming in through the Q&A box, let's go to the third poll.
Great. It's actually going to launch two questions at once. So polls 3 and 4 are together. So question 1 on this poll is, how important is it to have independent living centers engaged as the disability leaders at the hub level of the hubs and spokes model? And the options are very important, somewhat important, not important, or other. And the second question is, do you feel like you have enough of an understanding of hubs and spokes after today's town hall to give meaningful feedback and recommendations? And the options are absolutely, somewhat, not really, or I don't understand the hubs and spokes model. We've got about 30% of people have answered. We'll leave it open a bit longer. This is Megan. It looks like the answers have died down. So our first question here, I'm going to go ahead and end the poll and share results. Our first question on how important is it to have an ILC engaged as the hub in a hub and spokes model. 78% of people on today's town hall said it's very important. 17% said somewhat important. 1% said not important, and 4% selected other. And our second question, do you feel like you have enough of an understanding of hubs and spokes after today's town hall to give a meaningful feedback and recommendations? 28% of folks on this call said absolutely, 51% said somewhat, 15% said not really, and 6% said I still don't understand the hubs and spokes model. I'm going to go ahead and stop sharing now.
Thank you, Megan. And I'm going to turn it back over to Connie and Carol for some additional questions in the Q&A box.
Christina and Megan. So let's see, next question. Where'd that go? How will the launch of this initiative interact with and potentially enhance ADRCs across the state? Will funding opportunities through this initiative be available to ADRCs and ILCs?
Kim, do you want to take this one?
Sure. So right now, this is a 6-month kind of listening, engaging, and as we said in December, there will likely be findings. And again, I'll leave it to my successor, CDA Director Susan Damaris, and all of you to chart the way forward. But I would just say the ADRC program is in business. It is led by CDA in partnership with DOR and the Advisory Committee, which Eli co-chairs, of course, and has received unprecedented levels of funding in this year's budget for everything from ongoing local funding to the IT system, the state marketing system, the interoperability. So that continues, and I would direct you to CDA program leadership for the latest on emerging, designating, training, TA funding opportunities. That is really ramping up in leadership and partnership with DOR and the Advisory Committee. We'll be looking to bring in DHCS even closer as we explore Medicaid funding and of course continue with our federal partners. So ADRC continues. This is really, again, planning. And to another question in the chat, any changes that were to be made in AAA, as all of you may know, would not happen overnight. They really are happening in a conscious, intentional planning way. So for example, when LA Board of Supervisors said, let's take a look at our AAA structure, LA kind of uniquely has both a county and a city AAA. They had an 18-month planning process, and they're underway in planning that, advertising for a new director of aging at the county level. It's a multi-year process to transition, and that's part of why they're getting in there now to make sure their ILC partnership is connected to that evolving aging structure. And so again, if that were to happen, that there were either a designation change of a AAA or a map change that triggered a designation change, there would absolutely be a comprehensive, intentional, transparent transition plan, with the bottom line being, not interruption of services and not a setback to program development. So no need to worry that a switch is being flipped December 15th. That's not at all what's happening. It's really trying to move forward the conversation and focus on what do we need to do more work on and how do we do it together. And I do want to speak to the hub and spoke being a fuzzy concept. It is, and we welcome your feedback on how to make it clearer. But, I've been so enjoying these town halls because, when you hear San Francisco define hub and spoke, the model that Shireen McSpadden built there, she talks about a benefits hub that has, I think, 13 community hubs. And what she has done, and now her successor, Kelly Dornan, is doing, is in 13 communities around San Francisco, a very small geographic county, there is a senior center that is really an in-person community hub. So they are in the Mission, they are in Chinatown, they are in the Castro, the LGBT community, so that there are very culturally specific anchored physical places that are really, I might call them spokes, but she calls them community hubs to bring them into the community. And which you can then get all the services off of them. Fast forward to last week, hearing from the Siskiyou AAA, who says, I cover a geography larger than many states. Physical community places are not necessarily helpful for my community, who would have to drive an hour or so to get them. We may not have a physical hub. We may be entirely phone-based. And we may have some locations in Reading or some, but not, that model would not work with that kind of terrain. So I take the point that we need to continue to try to communicate more clearly, but I also hope you take the invitation to co-create that definition and that hub and spoke to be what it is for your community, your organizations, and the services available in the way that people want and need to get them.
Thank you, Kim. Connie and Carol, do we have additional questions in the Q&A box?
We do. I'd actually like to read this one. I'd like this linkage. Medical student here, what resources are being put into training future and current healthcare professionals on the importance of ILCs? And I would expand that to the full array of long-term services and supports, but I like the linkage. Would anyone like to respond? I know there are several initiatives like CalAIM investments.
Eli or Larry, would either of you like to respond to this?
I would just, I can't really speak necessarily to the resources being invested other than to say this is critical. I've done training and worked with medical students, and very little effort and time is spent facilitating encounters between those students and the disability community. And it's incredibly important and valuable. It's something that I hope to continue to work on in the future.
And I would just add one opportunity we have through our One Door ADRC is we coordinate or co-facilitate a intern program for nursing students in partnership with the county. So what great exposure for nursing interns to be exposed to AAAs and independent living centers, the social model of disability, ageism, ableism, and the intersection with racism. And so to the extent that we make our ADRCs and hub and spoke networks culturally competent, peer-led, focused on social justice, we have an opportunity through internship programs and working with community colleges and universities to ensure that the next generation of medical leaders really have a person-centered model for providing care.
And just briefly, one more promising practice that we included in the Master Plan for Aging is the Geriatric ED Emergency Department Initiative out of West Health. All of the San Diego County EDs have been certified, first in the state, really where, for example, when a person falls, we don't just set the cast, but we find out what happened and try to do maybe a home modification, provide for meals the next couple weeks, friendly visitors, et cetera, to make sure that fall is really truly seen in context and prevented, and full recovery to independence is supported. So something we're looking at how to explore with partners, since some of these issues do present in the ED.
Thank you, Kim. I think along this question, now would be a good time to have our commercial come into play as well. And I think one of the things that I've learned through my work in aging and disability with CFILC and our partnership with C4A is that there's a lot of training and a lot of new things that I stand to learn, as well as I'm sure my colleagues at C4A would say as well. I invited Jan Garrett from the Pacific ADA Center to join us today, just to give us a little brief commercial on what the Pacific ADA Center is, because accessibility and making sure that our programs are inclusive of people with disabilities is something we're all working towards. I thought it would be great to learn about this wonderful resource in California. Jan, can you join us?
Yes, can you see me and hear me?
Yes, perfect, thank you.
Thank you. Well, thank you so much for allowing us to be on today. And I just wanted to give you a little bit of a sense of who the Pacific ADA Center is and what we do. Now, what all of you may not know is that people with disabilities come in all ages, obviously, and all disabilities, and that people who are older adults or seniors may not even realize that they're persons with disabilities. They may not realize that they have entered that category. And you don't have to call yourself a person with a disability, but you still may have rights under the ADA. So it's important to know that for all of these state and local government agencies, nonprofits, businesses, and individuals with disabilities of all ages in our service area, which obviously includes California, that people know that they can contact us. And they can contact us at our toll-free number, which I know is being put up in the chat. Thank you so much, 1-800-949-4232. And you can reach us at that number anywhere in our region, which includes Arizona, California, Nevada, and Hawaii, as well as the Pacific Basin territories. And we can answer your questions through our technical assistance line or through email at adatech@adapacific.org, which is also in the chat. And you can also explore our website at www.adapacific.org. Lots of resources, lots of materials on our website. So I really encourage you to contact us for information. Everything is confidential. All of our technical assistance is free. And then if you do, if anybody needs training, please contact us for training as well, because we are available to do that and really can help people understand not only about the ADA, but about the state laws, about the Rehabilitation Act, other disability rights laws, and how those laws interact. So really, we would love to partner with this great hub and spoke model, all the ILCs and the AAAs and ADRCs. So thank you so much for this time.
Thank you, Jan. Thanks for joining us. I want to thank my co-sponsors, both Carrie and Aaron, as well as our partners from California Department of Aging, Connie, Nelson, and Kim, and Carol from the Commission on Aging for joining us today. Aging and Disability Resource Connections have worked hard to lay the groundwork for what a no wrong door system can look like and how it can benefit both our communities. As we continue to build back better and expand ADRCs into new geographic areas, it is critical that we also create a hubs and spokes no wrong door system that is both equitable and inclusive. We need to hear from all of you. I hope today was helpful in understanding more about the hubs and spokes model. And again, October 15th is the last day to submit public comments to CDA's website. If you haven't had a chance to take the survey on their website, I invite you to do that. All of this information is going to be very helpful in ensuring future services and programs for all of our populations. And if you haven't already had a chance to submit public comments, you may also do that on CDA's website. There is a short evaluation that we ask all of our attendees to take. If you could possibly send that to us, or actually it'll automatically generate, if you could please take the time to take this survey. It helps us figure out what our community's needs are and what kind of events to bring to you next. With that said, we do have a hashtag California Coming Together conference on behavioral health on Thursday. I hope to see many of you there. And if you need information on that, it is on the CFILC.org website. We are taking registration until tomorrow, and it is under our upcoming events. With that, I will just open it up to Carrie or Aaron if you'd like to make any final closing remarks for today's event. And again, thank you to CDA for helping us.
Christina, I'm just so grateful for the invitation to be here and glad to be helpful in any way that we can. Thank you.
And this is Carrie. I would echo that and say thank you for helping to bring us all together. And we're very interested in collaborating on this in the future.
Thank you, Carrie. And again, our evaluation is in the chat. It looks like Nelson just posted it. So if you could please take that survey, we'd appreciate it, and want to thank you all for participating today. Have a wonderful rest of your week. Bye-bye.
Really quickly, this is Megan. That is a separate survey. The survey for this town hall will open up in your browser as you leave this event. Thank you and have a great day.